Welcome to Talkin' Ship, the Venture Asheville podcast, where we talk about issues and topics in entrepreneurship. If you're looking for a podcast on tips for working from home with an infant, that's our sister show, Help, I'm Covered in Ship, Entrepreneurship. With me today is the second assistant director of Venture Asheville, my daughter Madeline. If you haven't watched our podcast before on YouTube, now's a good reason to. Jay Walker, let me ask you, do we look alike?
You do look a little bit alike.
A little bit?
I'm not
I
great
was
at
a
looking at a baby
6-month-old
face.
girl. Would I look like that?
I
Some
think,
people say yes.
yeah, I think, yeah. Very cute.
Anyway, who are we? We are the Venture Asheville team. Venture Asheville is the high growth entrepreneurship initiative of the Economic Development Coalition for Asheville-Buncombe County. Whew. We build entrepreneurs and get startups funded. I'm Jeffrey Kaplan, this ship's captain, director of Venture Asheville. As I said, my daughter is joining me today because no nanny means daddy nanny. There's got to be a better word. I want to use manny because that just feels so gendered, but maybe there's another word to describe a working from home.
Fanny, father nanny.
Fanny. I'm a fanny today. Well, why can't dads be nannies? Anyway, director of Venture Asheville and lover of, speaking of great dads, Justin Jones Fosu. Justin was the first speaker at TEDx this year, and one of the things he spoke about was DEI from a lens of curiosity and seeking to understand. And he tells us a great story about his mom. So she would take him and his siblings to every single cultural event or heritage festival in their town growing up. And because of that, she built in her kids this value of curiosity and love of all cultures. And so my wife was watching Justin's, and her talk really affected her. His talk really affected her. So here in Asheville, we have like a festival every weekend now. We're deep into festival season. It's going to just get more and more intense through September. Anyway, she's all fired up about bringing our kids out to every single festival, whatever like cultural experience we can expose our kids to. She wants to do it. And this weekend is Grind Fest. Now, I know this podcast will air after Grind Fest, but it happens every year. It's an incredible celebration in the River Arts District, specifically of Black entrepreneurship. And it's hosted by our dear friends from Black Wall Street. We're thrilled. We're all excited to go out and spend the weekend down the river with these folks and seeing the entrepreneurs and the vendors and the shows. And there's a live drag walk down the Greenway, and all kinds of awesome stuff's going to be happening. We'll have the whole mishpacha out there. Jay Walker, will you be at Grind Fest this year?
I will be at Grind Fest. I'm very excited. I do need to go to IKEA this weekend as well and get a bed frame. But
okay, well, it's a 4-day festival, so it's
exactly.
It's Friday,
so I'm
Saturday,
gonna
Sunday, Monday.
probably go Friday or Sunday. So
I'm going ribbon cutting Friday. It's a chamber thing too. We'll all be there. 12 o'clock Friday.
Definitely will be there. So
With me,
I'm
as
super
always,
excited.
I just steamrolled right past her intro. With me, as always, is the wonderful, smart, talented, considerate, and creative Juliana Moon Walker, our master of interactive media, Moon Walker. Other than going to IKEA this weekend, what's good?
Well, I'm finally recovered from the bachelor party I went to this weekend. Yes, bachelor. It was a mixed group of all genders and sexualities. And it was a wonderful weekend in Miami, in your hometown.
I believe it's Miami.
Miami. Excuse me. I should know that by now. But yeah, I went down there with no freckles, no sunburn, and no tattoo, and I came back with all three. So lots of
First thing I
skin
said
stuff
to you
going on.
when I saw you Monday, how's Miami? You go, I got a tattoo. Anyways, I was very proud of you.
Yes.
You fit in actually more. Actually, for those of you who don't know this, she actually got a raise at the Chamber of Commerce for having a tattoo. So we're very proud of Jay Walker for that. I'm glad you had a good time in Miami, my hometown. Well, our guest today is Dr. Benjamin Aiken. I don't know if he's not from Miami. I believe he grew up in Tennessee. He's a founder of Lantern Health, pioneer of direct primary care, and a solid backstroke swimmer. That's right, Ben. I've seen you at the JCC pool. Lantern is a 2-time Venture 15 winner. We have a lot to discuss about how they operate and what's helped them grow so fast. Dr. Ben, welcome to Talking Ship.
Thanks for having me, Jeff. It's great to be here.
Great to have you. And obviously, out of full disclosure, hope we're not violating HIPAA. I am a client, a patient at Lantern Health. I hope that doesn't. Hope this podcast doesn't revoke that membership anytime soon.
It does not.
Okay, very good. So first question, people who may not be aware, what is direct primary care?
It's a great question. It's still not a concept that most people know. At its core, I think of it as just a different way to pay for primary care. So rather than do what is called fee-for-service medicine, which is the standard, where every time you go in to see your primary care provider, a claim is generated and there's a charge for that service. So it's called fee-for-service. Direct primary care is more like a gym membership. So rather than pay every time you come to be seen, you simply pay a monthly fee. And for that monthly fee, for the majority of primary cares, you get unlimited visits. So those are in-person visits or virtual visits. And then a series of other services that are generally listed transparently on the different practice websites or practice pamphlets that you may see. So at its core, it's just a different way to pay for primary care. I think where it gets interesting is, well, what do you get for that fee? And that's where you see different flavors, if you will, looking at different direct primary care practices. Just to elaborate a little bit, some will say, well, hey, why would you do it that way versus a different way? Part of it is related to incentive alignment. So in a fee-for-service model, as a physician or primary care provider, you are actually incentivized to do more, to see more volume. The way that you keep your lights on is that you see more. So in some ways, the sicker someone is, the more they have to come see you and the more you make as a primary care provider. So it's not really, it's kind of fits with this sick system that some people will describe our healthcare system as being. In direct primary care, our incentive is actually flipped. Our goal is to keep our members, our clients, our patients as healthy as possible so that they don't come and see us ultimately every week. At the same time, one may say, well, okay, I get that. Well, why don't you just try to incentivize them never to come? And then you just get a monthly fee and you're not actually having to do anything. The direct primary care is actually a direct relationship. So basically, I think of myself, my boss in the relationship is the patient. If they are not having a good experience, they can simply fire me and move on. So there is clear built-in incentive that patients want to sense that we are engaged, we're seeing them regularly, we're providing a service to them. And if we're not, they can go somewhere else. So that's the direct in that relationship that keeps it balanced.
Can we dive in a little more on the experience you're touching on? I think this is really clever to flip the incentive for the provider, keep people healthy, keep them out. But you guys are insanely accessible. So can you talk a little bit about the experience, how you manage it? And my one, I've been able to text you through the app for any little thing I have, and it's a great experience for me. But I think about even when I go in to visit you in the clinic, I get there, on time or a couple minutes early of my appointment. You expect to wait at a doctor's office, but my experience at Lantern is a sit down, and the greeter, already knows who I am when I walk in. I guess they know who's coming on the schedule. They say, "Hey, Jeff, come on in, grab a seat. Would you like any coffee, tea, or water?" And by the time I'm like turning my head to that little kitchenette, you already out there at the door waiting for me to come in the room. Like I don't think I've ever waited long enough to even get a sip of water at Lantern Health. So how did you come up with this experience, and what do you prioritize in the values of the customer experience?
Yeah, it's a great question. I think that when I was in the early kind of creative phase of building the practice, we basically tried to take my physician hat off and put a consumer hat on in every decision that we made. So part of the beauty of really getting to be creative of what's included or what is the experience that somebody is paying for is really to be able to kind of just question every step of the process, and rethink it in a way that is focused on a much better experience for everybody involved. So one of the you know benefits of the model is that we get time back. So our shortest appointment time is 30 minutes. We spend 60 minutes at our annual appointments. We really get to reemphasize that relationship and not feel rushed. In a volume-driven system, you have to see generally 25 to 30 patients a day to keep the lights on based on how you get paid by insurance companies. And you're mostly focused on checking the right boxes so that you actually get paid by the insurance companies. In this model, since insurance is not involved at all, we can just really refocus in on what makes sense in terms of providing good care and a good experience. So one of the benefits in this model is we don't really need a waiting room as you traditionally think about it, because we don't have to see 25 to 30 patients a day. An average day for us is somewhere between maybe 12 and 14 patients. We don't have to see patients in person. We can see patients virtually. Prior to COVID, about 60 to 70% of our care was already virtual. And that was just consumer demand. I share the story sometimes that we'd been open for a week and a half, and a patient of mine videoed in from underneath her covers in bed at home. And initially I was just kind of taken aback. I was like, okay, well, this maybe is a little forward. And then it started happening over and over again. Ultimately, she was concerned that she had the flu. If you're concerned you have the flu or you feel like you have the flu, where do you want to be? You want to be in your bed at home because you feel terrible. And if you can video in and have an initial conversation with your doctor about it without having to get out, and then maybe if, ultimately things are able to be diagnosed from a virtual perspective, I can send in a medicine that can be delivered to your door and actually you never have to leave the house. It just makes a lot of sense.
As soon as we get drone delivery, there's no human touch in that process. I can't wait for the day that drone
right.
comes to your office. You put something in there in a little lockbox. It zips over that person's house or their window. Who knows, right? They put in the code, pull out their prescription, and I hope that
Absolutely.
future is soon. I hope it's soon.
Absolutely. Yeah, we're seeing technology as well that will allow me to look in your ears from a distance and other things
Oh, yeah?
that will be more consumer focused, or listen to your heart from a distance. So those things are near to, probably on the horizon near term.
I feel like now's
So
a
it's
good time
exciting
to
to see.
plug Elite HRV, which rebranded to Spren, and their technology
Mhm.
has become so advanced because they have the world's largest database of heart rate variability information, and their computer, they call it computer vision, and their machine learning and AI is so advanced that with the webcam, they're now reading your vitals. And like as that becomes more advanced, right? Or even Go Check Kids, which our friends at Pisgah Fund just invested in,
Mhm.
right? They're diagnosing pediatric ophthalmology issues with a standard iPhone camera and their
Absolutely.
software. So
Yeah, both.
that's pretty exciting stuff.
It is. We're using the GoCheck software here,
Are
and I
you?
know the
Nice.
folks at Elite HRV. It's fascinating and really,
Hmm.
I would say, groundbreaking what they're doing. It's really
Yeah, for
exciting.
sure.
So ultimately, though, Jeff, I think in response to your question, we really just get to reemphasize the experience. It's a much better experience for us as providers. Our patients tell us that it's a much better experience for them, and really, ultimately, kind of the experience that the doctor has become so dismal that even small
Hmm.
things feel good, and we
Sure.
really want to take it further than that, so that it really is an excellent experience.
As again, I already told you, I think the experience is great, but because we're not rushed, and because I know that time is dedicated for me as a patient, we can get pretty deep and cover things that I didn't want to, think that I was going to cover today in my annual appointment. Like we really get to have the relationship that when I was building software for medical professionals, for example, we'd always say, um, doctors don't become doctors because they like doing paperwork. They become doctors because they want to help patients. But because of the medical system, the sick system, the insurance system, they're always stuck in the paper trail, right? And when I spend time with you, or even Rachel and other folks in your team, Lisa, right? Like I know I'm being heard and I'm being seen for a whole person, and that's where I hope more medicine goes. And you guys, I call you a pioneer in that space. Since I mentioned Rachel and Lisa, can you tell us a little bit about your team? You've got an incredible group of folks over there. Um, how do you recruit? How do you find these people? What keeps them around? Tell us about your team.
Yeah. So our team is, I guess, in some ways made up of, I would say, kind of three components. So one is the physicians and the providers on the team. So we now have 4 family physicians on the team, and we also have a certified nurse midwife that is helping on the team, and a 5th provider that is slated to join us in August. So also a family physician, which we're really excited about. And we do all the kind of typical doctor stuff as family physicians. 2 of our providers, both the nurse midwife and one of the family physicians, still do delivery care, prenatal and delivery care, and pregnancy care. So that's been a really fun aspect of our practice and kind of a interesting way to push and test this model in that space. Such an important and daunting and exciting time for families that are going through that. So something that we really enjoy. We also, the second kind of group of our team is health coaches. So when we started to look at the data in terms of how do we help people really work to achieve optimal health, health coaching is a way to help do that, that has good data, and it's increasing in popularity. So we have a nurse health coach, so a registered nurse that also functions as a health coach. And we have Lisa, who you mentioned, is an integrative health coach who did her training through Duke University. And they are really there to work on any aspect of health with our patients and our members, and are just as accessible as any of the doctors on the team. In the midst of COVID, which almost no matter who you are or where you were, it just was an intense period of time for all of us to go through. And Lisa, with her focus on mental health and mindfulness and behavioral health support from a health coaching perspective, was our most in-demand team member by far during that period of time. The final group is more administrative, so our front desk support, and help with management on the practice side. And really, I've kind of carried the bulk of the practice operations piece, and I'm just nearing the point where I'm bringing on somebody to help me do that in June, which I'm very excited about. So that's
So
the core.
let's recount the total head count. 5 practitioners, which I think started with 2. I'm sorry, I shouldn't say practitioners, but
Right.
And then the wellness team, and then admin.
I think we're
12 people, 11 people.
We're currently, yeah, that's right. We're currently, I want to say, at 10, and we will be at 12 within a couple weeks.
Is it a 4-year-old, 5-year-old venture?
Yes, we launched in March of 2018. So
yeah,
in the 4th year. Yeah. So
that's pretty great growth. And we talked about this last time on our not last time, but episode 3 with Greg Hardy from Rockgeist. About the same age, and he started this as a side project. He just liked making these bags for the bike packing, and he's also at maybe 12 people, maybe 10 to 12. I mean, that's not an easy thing to do. Suddenly when it's just you and Rachel and 2 or 3 staff, your team meetings are simple, right? Everyone talks, everyone knows each other. You're doubling your team in size in 2 years, and that communication and the hierarchy, suddenly it gets complicated.
It does. So, I mean, I think we have, we almost treat it like a family. And our vision for this current location here in downtown Asheville is that we're really at capacity at that number. So if we are to grow further, that means additional locations. And part of the design there, I think, I talk about it as the Cheers effect. You kind of mentioned this and set this up nicely, but I really want this practice to be a place where everybody walks in and it feels like everybody knows your name. Kind of love that concept. And part of the goal in keeping it at that number, really kind of the concept of a 3 or 4 provider per location practice, is that it still feels intimate and important to, kind of that connected for folks that are walking in the door. Inevitably, no human is available 24/7, 365. And if you're a member here, there is a chance you're going to need to see somebody else on the team if you have an acute issue. And we want you to still feel like that's a graspable thing where, hey, even though if you primarily see me, you get to know Rachel or you get to know one of the other team members. And there's some interesting data. I don't think it's robust, but it is nonetheless provocative, that suggests that when you get above 4 providers per location, quality metrics start to go down. Which I think, I guess if I were to extrapolate that, it's kind of the idea. If you just go to a practice, let's say where there's 40 providers and nobody ever knows your name and you're just a number, it maybe feels less connected than it does if it's a smaller practice. So an interesting thing to think through.
So I think about, I've talked about the veterinary side of this because my wife's a veterinarian and I know that practice pretty well. And so she's been at this one practice for 5 years now. And it's like the longer she's been there, the more select her clientele gets, but it's more renewals. It's more that patient comes back to see that doctor. So the longer she's in practice, the more robust and deeper her relationships get. But I mean, that practice is intentionally made to be that way, right? And so the new people who have less or more availability get the new patients, and then they become your patient for the life of that animal. But I mean, people love that about the veterinary side of things, that you see the same person every time, gets to know them really well, they know your pet and the history behind it. Um, and so I've always felt like this model would be great for veterinary clinics. I still haven't convinced my wife to do that yet. And if you're her employer and you're listening, please be assured that Danielle is not leaving the hospital anytime soon. She's not taking up my offer. Um, what is it about Asheville that has helped Lantern Health grow so much and so well?
Asheville really, it's quite striking. This model, we currently have 5 direct primary care practices in a town our size, and
Hmm.
as a point of comparison, Winston-Salem and Greensboro, both of which would be considered larger markets, have
Hmm.
0. There's one opening, I believe, in Greensboro later this summer. And so Asheville's clearly kind of well suited to this. I mean, I think one, there is generally a more innovative, kind of alternative,
Hmm.
progressive minded aspect of Asheville that still values local and still values relationships. And so I think that, folks that tend to gravitate toward living in this community, or those that have been here for a long, long time and with deep roots, like that sense of connection. And so
Hmm.
this model is really oriented towards having that deep sense of connection with your physician or your provider. And so that's an attraction. Um, Over 50% of our members come from local businesses. So we now
Wow.
support, I want to say 37, almost 40 local businesses who pay for this as part of their benefits offering. And those range in size from a 3-person watchmaking shop to
Hmm.
over 400 employee full scale retirement community, and then a little bit of everything in between. And so, um, the thing to speak to, I think that part of why this is attractive, it has done well in Asheville, is that small businesses in particular have traditionally had a lot of trouble accessing good healthcare benefits,
Hmm.
mainly because the cost is prohibitive. And in addition to the cost being prohibitive, the experience is just kind of blah,
Yeah.
as it is for healthcare broadly. And so as those small businesses have started to look for alternatives, this comes as a very straightforward, transparent, viable alternative, and has really been a great source of our growth. Um, and part of, I think, why this model has succeeded in the Asheville area.
Yeah, I mean, it's smart for the employers, right? Because a healthier workforce would be a more productive workforce. Um, it was not healthcare, not sick care, right? So if you're seeing your doctor regularly, if you're doing all the wellness checks, you'll spot things earlier, be able to, plan accordingly. And I mean, it does help the company's bottom line too, right? I mean, the
It
more you're in
does.
the office, the more you're productive and able to get stuff done. Um, so what's next? You mentioned the possibility of new locations. I'd love for you to touch on the consulting you're doing to help other areas spin up direct primary care clinics as well. So what's next for you and what's next for Lantern?
Yeah, good question. I think Lantern is at this kind of decision point of, do we stay the course as a single location and kind of, focus there, versus replicate. And if we replicate, where do we replicate? The entrepreneur in me is really ready to grow and replicate. And I would say there is demand from both kind of Asheville, like sections of Asheville, south, north, east,
Hmm.
west, if you will. There is interest in rural Western North Carolina, especially in areas where
Certainly.
it's
Yeah.
harder to get primary care consistently, and a good experience. So, one, this is a very attractive model to physicians to join. I have probably a handful of physicians that have indicated their interest and almost ready to join,
Hmm.
that I would love to strategize and try to figure out a place to have them. And then there's some that are actually some interest that's more statewide, and more regional, where employers, as examples, have reached out, as an example, have reached out and said, hey, we have X number of employees. Would you be willing to put a Lantern location here? So stay
Hmm.
tuned. I anticipate that, that we'll work towards replicating, and have some clarity around where that may be before the end of the year. But some things have to come together. But I would love to try to grow what we've done with a regional focus, to offer it to more folks and provide an avenue for physicians who are burned out in the kind of sick system that they're working to transition out without having to carry the burden of running the business as well. So that's, I would say, where we're at from a Lantern perspective. On some side work that I've been involved in. So I've been supporting a startup insurance company called Decent Health that is about 2 years young and builds its entire insurance platform around this primary care model, which is really interesting and quite provocative. So it's basically and trying to kind of take on the status quo players in the insurance world, and it's starting its offering with a focus on small businesses. So really the customers that we're serving. So it's been a really fun and kind of exciting opportunity to learn up a little bit more on kind of actually how insurance plans operate and exactly how we could strategize for them to just do what they're designed to do, which is cover the unexpected and the catastrophic things. Do that well, but do it at a price point that is much more achievable and sustainable for small businesses, but also for individuals longer term. It's also been a really fun opportunity to try to help grow the direct primary care movement more nationally. So it's still relatively niche, direct primary care, but if you look, the growth in the past kind of 2 to 4 years has really started to accelerate. So kind of high level numbers, if you looked at all family physicians across the United States, about 2 years ago, maybe 2.5% were in this type of a practice. And now about 5% are in this type of practice. So still small from an overall percentage perspective, but that kind of growth really starts to show what the possibilities are. Physicians especially are pretty type A and risk averse people, which overall is a good thing, but convincing them or kind of nudging them to basically leave a salaried position with security, even if it's really actually kind of a dismal work environment or they're feeling burned out, is not an easy task. But those of us that were, I think, willing to take the leap early, and really try to make as much of what we've done open source as possible to really help facilitate this movement growing and have more and more providers join really across the country. So it's been fun to kind of see at that higher level, one, to try to facilitate this insurance company to bring a solution to the market that doesn't exist. We're currently offering plans in Texas, and because I have a leadership stake, I get to nudge towards North Carolina.
Nice.
As an expansion state, hopefully sooner than later. But also to really interact and interface with physicians all over the country who are looking for something different, already trying new models like direct primary care, and trying to basically kind of be the change we want to see.
Well, man, it's super exciting for you. I do have a question about the 2020 Venture 15. Okay, so I shared my screen. For those of you who are watching on the YouTube, you'll see a clip in a moment. Jay Walker, as an editing note, I did not share the audio, so it won't blow everyone's brains out when you hear the audio. So one of the things we did to celebrate the 2020 Venture 15, it was all on Zoom. And it was a mix of live video and recorded videos. And I wanted to give all the employees and all the teams of Venture 15 companies a chance to have like a shout out and some screen time. And so I copied this out of the playbook when I was a middle school teacher, and I ran the AV club and the audio video room and the multimedia classes. One of the things we would do is send kids out all across the school to take 5-10 seconds of somebody dancing, and then you take these clips of all your administrators and students and teachers and staff, everyone at school, and make a little music video about it. And so it was a big surprise for everybody where we had all the companies submit like 5-10 seconds of people dancing. But the dance move that stole the show in 2020 was this one from Lantern Health. So Ben, I'm gonna play it. If you would kindly dictate what's happening on screen, because I don't know what to call your dance move, but it's the most memorable moment from the 2020 Venture 15. So I'll play that now. We see your lobby. We see a limbo bar and 4 employees, and you're off screen to begin. Do you want to take it from here?
Sure, I'd be happy to take it from here.
Okay, so I'm playing now.
We have some strong limbo team members here showing their skills. And then sometimes you just need to come out of nowhere and excite people, especially when you have a slick floor in terms of a strategic move.
So let's break this down. It's actually not a limbo bar. I'm looking at it now, and that's a blood pressure cuff. Is that right?
It is a blood
hose?
pressure cuff with the cord connector. Yes, your
Okay.
eyes are better than mine.
And I got a bigger screen here. And then I don't think you described it. So it's not exactly the worm, but we see limbo. It's Rachel. There's Lisa doing the limbo. She kind of went shoulder in, and you come in sliding. So you are on your belly. Your hands are doing the work. So if you could imagine this, and your knees are bent at like 90 degrees. So your feet are over your head, height wise, and you come sliding like a serpent almost. You get under the limbo bar, and you do this crazy 180, and then you start going backwards. And there you go off camera into one of the rooms. And that's it. And that's the whole thing. Did you know you could do that dance move before you started, or was this just like a party trick you always do? Tell us more about that dance move.
Yeah, I wouldn't say that it's a party trick per se, but that's not the first time that I've done that dance move. One of the benefits of that dance move by being on your knees and your hands is that you can really go in any direction that you want. So the floor at Lantern is not quite a hardwood dance floor, which is generally ideal for this.
Yeah, sure.
But yeah, it's quite an enjoyable move. You should try it sometime.
Do you have a name for it?
I don't. I need to
give
work
you
on
one?
that. Yes, please.
Because you can spin so quickly and pivot any direction, I want to call it the dreidel.
The dreidel.
I will bust it out at the next Hanukkah party I attend, if
Love
that's
it.
okay with you, if I have your permission. Well, those are all my questions. As per tradition, we give Jay Walker the final question of the podcast. Jay Walker, what do you got for Dr. Ben?
Yeah, I mean, honestly, you've covered everything that I was going to ask. Family, your focus on families, your focus on really interacting with your patients and all that. What I want to know genuinely, not to keep it on the dance move, but I need to know how to do that. I'm going to need a lesson next time I see you in person. That's all can you do
You can
that?
schedule an appointment.
You got it. You got it.
App.
It
Schedule
does
an
hurt a little more on your knees than you might expect, and it does require some good core and shoulder strength. But once you have those things, it's game for everybody.
All
You
right,
must
I'll
get
be
that
working
good
on
core and
that.
shoulder strength from the backstroke you do.
Well, thank you so much for being on with us.
Thanks for
Before we
having
let
me.
you
It's
go,
been a pleasure.
how do people keep up with you and Lantern Health? They're curious. Is there a website, a phone number, physical address? How do they find you?
Yeah, it's a great question. LanternDPC.com is our website. We try to keep it somewhat up to date. My email is simply ben@lanterndpc.com. People are welcome to reach out to me directly. Our practice is downtown at 84 Cox Avenue, so right across from Asheville Pizza and Ben's Tune-Up, which would have been another good name for the practice. Maybe next time.
Oh, that would have been really good. Dr. Ben's Tune-Up. No trademark dilution there.
But anyway,
No
yeah, that's we have some
Great.
social threads as well. People can follow us there if that's their preference.
Well, thank you for keeping me personally healthy and a lot of our office healthy, and for what you're doing for Asheville. Dr. Ben, great to see you. I'm sure I'll see you soon. At this point, Joe Walker, you got the tunes playing, right? Our outro is happening, and we'll see you on the next episode of Talking Ship. Thanks.